Nurse Aide Test Prep GCU. Question 1. A client with dementia becomes combative during a bath. The nurse aide should: Option A. Finish the bath quickly while being firm. Option B. Stop and try again later when the client is calmer. Option C. Restrain the client to prevent injury. Option D. Leave the client without finishing the bath. The correct answer is option B. Stop and try again later when the client is calmer. Forcing a bath on a combative client escalates the situation. Stop, assess the cause, and attempt later with a gentler approach. Restraint should only be used with an order and as a last resort. Question 2. A client expresses sadness about not seeing their family. The nurse aide should: Option A. Tell the client they will visit soon. Option B. Allow the client to express their feelings. Option C. Change the subject. Option D. Call the family immediately. The correct answer is option B. Allow the client to express their feelings. Allowing expression of feelings validates the client's emotions. Making promises, A, may be false. Changing the subject dismisses the client's concerns. Calling the family, D, may be appropriate but is not the first therapeutic step. Question 3. A dying client is breathing irregularly. The nurse aide should: Option A. Call the nurse immediately. Option B. Continue to provide comfort care. Option C. Administer oxygen. Option D. Start CPR. The correct answer is option B. Continue to provide comfort care. Irregular breathing, Shane Stokes, is common in the dying process. Comfort care, including oral care and repositioning, should continue. CPR is not indicated unless the client has a DNR status. Do not resuscitate. Question 4. A client with a history of COPD should have a target SpO2 of: Option A. 100%. Option B. 94 to 98%. Option C. 88 to 92%. Option D. 85 to 88%. The correct answer is option C. 88 to 92%. For clients with COPD and chronic hypercapnia, the target SpO2 is 88 to 92%. This balances adequate oxygenation with avoiding oxygen-induced hypercapnia. The target for healthy clients is 94 to 98%. Question 5. What is the correct order for putting on personal protective equipment, PPE? Option A. Gloves, gown, mask, goggles. Option B. Gown, mask, goggles, gloves. Option C. Mask, gloves, gown, goggles. Option D. Goggles, gloves, mask, gown. The correct answer is option B. Gown, mask, goggles, gloves. The correct sequence is gown first, then mask, goggles/face shield, and gloves last. Gloves are most likely to become contaminated and are removed first during doffing. Question 6. To prevent aspiration during feeding, the nurse aide should: Option A. Feed the client lying down. Option B. Feed the client with their head tilted back. Option C. Feed the client in an upright position. Option D. Feed the client only pureed food. The correct answer is option C. Feed the client in an upright position. Upright positioning, Fowler's position, 45 to 90 degrees, allows gravity to help food move down and protects the airway from aspiration. Lying down or tilting the head back increases aspiration risk. Question 7. A client with dementia has a tendency to wander. The nurse aide should: Option A. Place the client in a locked room. Option B. Provide a safe wandering area. Option C. Use restraints. Option D. Ignore the behavior. The correct answer is option B. Provide a safe wandering area. A safe, enclosed area for walking addresses the need to wander safely. Locked rooms and restraints are restrictive and require orders. Ignoring the behavior is unsafe. Question 8. When weighing a client, the nurse aide should: Option A. Weigh the client at different times each day. Option B. Weigh the client at the same time each day. Option C. Weigh the client after meals. Option D. Weigh the client before toileting. The correct answer is option B. Weigh the client at the same time each day. Weighing at the same time each day, example, before breakfast, provides consistent, accurate monitoring. Different times, after meals, or before toileting can cause variations. Question 9. When taking an axillary temperature, the nurse aide should leave the thermometer in place for Option A, 3 to 5 minutes. Option B, 5 to 8 minutes. Option C, 8 to 10 minutes. Option D, 10 to 12 minutes. The correct answer is option C, 8 to 10 minutes. Axillary temperatures require 8 to 10 minutes to accurately reflect body temperature because the armpit is a peripheral site. 3 to 5 minutes is insufficient. For electronic thermometers, follow manufacturer instructions. Question 10. When assisting a client from lying to sitting position, the nurse aide should Option A. Have the client sit up quickly. Option B. Sit the client up slowly and allow time for blood pressure to adjust. Option C. Pull the client's arms to sit them up. Option D. Have the client hold their breath. The correct answer is option B. Sit the client up slowly and allow time for blood pressure to adjust. Sitting up slowly prevents orthostatic hypotension, dizziness, fainting. Sitting up quickly can cause a dangerous drop in blood pressure. Pulling on arms can injure shoulders. Question 11. A client with dementia has incontinence. The nurse aide should Option A. Place the client in adult briefs without offering toileting. Option B. Offer toileting at regular intervals. Option C. Restrict fluids to reduce incontinence. Option D. Ignore the issue. The correct answer is option B. Offer toileting at regular intervals. Regular toileting maintains dignity and may prevent incontinence. Restricting fluids can cause dehydration. Ignoring the issue is neglect. Briefs may be necessary but should not replace toileting. Question 12. A client with depression refuses to get out of bed. The nurse aide should Option A. Allow the client to stay in bed. Option B. Gently encourage the client to get up. Option C. Force the client to get up. Option D. Call the family to get them up. The correct answer is option B. Gently encourage the client to get up. Gentle encouragement with support and assistance can help the client participate in care. Allowing them to stay in bed may worsen depression. Forcing them is not appropriate. Family members should not be expected to manage care. Question 13. When dressing a client with a weak right arm, the nurse aide should Option A. Dress the right arm first. Option B. Dress the left arm first. Option C. Dress both arms simultaneously. Option D. Dress the stronger arm first. The correct answer is option B. Dress the left arm first. Dress the stronger arm, left, first, then the weaker arm, right. This minimizes discomfort and strain on the weak arm. Dressing the weak arm first would require moving it more. Question 14. Which of the following can cause an inaccurate pulse oximetry reading? Option A. Nail polish. Option B. Client holding their breath. Option C. Client sleeping. Option D. Client sitting up. The correct answer is option A. Nail polish. Nail polish, artificial nails, and dark pigmentation can interfere with pulse oximetry light transmission, causing inaccurate readings. While breath holding and sleeping can affect readings, they don't cause device inaccuracy. Sitting up is a normal position that does not affect accuracy. Question 15. A client with dementia has difficulty eating. The nurse aide should Option A. Feed the client quickly to ensure adequate nutrition. Option B. Allow plenty of time and provide cues to eat. Option C. Puree all food to make it easier. Option D. Skip meals when the client is resistant. The correct answer is option B. Allow plenty of time and provide cues to eat. Clients with dementia need extra time and cues to eat. Example, pick up your spoon. Rushing can cause choking. Pureeing may be appropriate for some but not all. Skipping meals is neglect. Question 16. A client who is dying expresses a desire to talk about their life and experiences. The nurse aide should Option A. Redirect the conversation to something more pleasant. Option B. Provide active listening and allow the client to talk. Option C. Tell the client not to worry. Option D. Change the subject to the client's care. The correct answer is option B. Provide active listening and allow the client to talk. Life review is an important part of the end-of-life process. Active listening validates the client's experiences and supports their emotional needs. Redirecting or dismissing denies them this important processing opportunity. Question 17. How should the nurse aide shave a client who takes blood thinners? Option A. With a straight razor. Option B. With an electric razor. Option C. With a safety razor. Option D. The same as any other client. The correct answer is option B. With an electric razor. Clients on blood thinners are at increased bleeding risk. An electric razor is safest because it reduces the risk of skin cuts. Straight and safety razors can cause nicks that bleed excessively. Question 18. The nurse aide is assisting with morning care. The client prefers to perform their own care. The aide should: Option A. Perform all care for the client. Option B. Allow the client to do as much as possible independently. Option C. Rush the client so they finish quickly. Option D. Leave the room and return when the client is done. The correct answer is option B. Allow the client to do as much as possible independently. Promoting independence is a core principle. The nurse aide should encourage and enable the client to perform as much self-care as possible while providing assistance only where needed. Performing all care undermines the client's abilities and dignity. Question 19. Normal adult resting heart rate range is: Option A. 40 to 60 beats per minute. Option B. 60 to 100 beats per minute. Option C. 80 to 120 beats per minute. Option D. 100 to 140 beats per minute. The correct answer is option B. 60 to 100 beats per minute. The normal resting heart rate for adults is 60 to 100 beats per minute. Rates below 60 may be normal for athletes but are considered bradycardia. Rates above 100 are tachycardia and require reporting. The other ranges are outside the normal adult parameters. Question 20. A client tells the nurse aide that they want to harm themselves. The aide should: Option A. Keep the information confidential. Option B. Tell the client that they are being silly. Option C. Report it to the nurse immediately. Option D. Promise the client that everything will be fine. The correct answer is option C. Report it to the nurse immediately. Statements of self-harm are mandatory reporting. The nurse aide has a legal and ethical duty to report this immediately. Confidentiality does not apply when there is a risk of harm. Question 21. When counting respirations, the nurse aide should: Option A. Tell the client they are counting breaths. Option B. Count while appearing to take the pulse. Option C. Count for 10 seconds and multiply by 6. Option D. Count for 30 seconds and multiply by 2. The correct answer is option B. Count while appearing to take the pulse. Counting respirations should be done without the client's knowledge because conscious awareness can alter breathing patterns. The nurse aide should keep their hand on the client's pulse site while counting breaths to disguise the activity. Counting for 10 or 30 seconds is acceptable for regular respirations, but disguising the count is key. Question 22. The compression to ventilation ratio for adult CPR, single rescuer, is: Option A. 15:2. Option B. 30:2. Option C. 5:1. Option D. 10:1. The correct answer is option B. 30:2. For adult CPR by a single rescuer, the ratio is 30 compressions to 2 breaths. This is the American Heart Association standard for effective CPR with minimal interruption. Question 23. When documenting client care, the nurse aide should: Option A. Use vague descriptions. Option B. Be objective, accurate, and use only abbreviations that are approved. Option C. Include opinions about the client. Option D. Write in pencil so errors can be erased. The correct answer is option B. Be objective, accurate, and use only abbreviations that are approved. Documentation should be objective, accurate, and use only approved abbreviations. Opinions are not appropriate. Pencil should not be used, Documentation should be in ink. Question 24. A client with a pulse of 112 beats per minute is experiencing Option A, normal heart rate. Option B, bradycardia. Option C, tachycardia. Option D, arrhythmia. The correct answer is option C, tachycardia. A heart rate above 100 beats per minute in an adult is tachycardia. This is above the normal range of 60 to 100. Bradycardia is a rate below 60. Arrhythmia refers to irregular rhythm, not rate. Tachycardia may indicate fever, pain, dehydration, or other conditions requiring reporting. Question 25. When performing chest compressions on an adult, the nurse aide should compress the chest to a depth of Option A, 1 inch. Option B, at least 2 inches but no more than 2.4 inches. Option C, 3 inches. Option D, 4 inches. The correct answer is option B, at least 2 inches but no more than 2.4 inches. Adult chest compressions should be at least 2 inches deep but no more than 2.4 inches. 1 inch is too shallow. 3 to 4 inches may cause injury.